Next, we have Stephen Godden from BBC.
Thank you. Cabinet Secretary, can I ask you that, in your view, do you think the changes to the shielding guidance in England and Wales have come too early? And when can people in Scotland who are shielding expect similar changes, and what does that depend on?
So, as we've said before, Stephen, it is for those charged with making decisions for people who live in England, for them to make those decisions. And I don't know what information or evidence they might have been looking at in order to reach the view that they have reached. And I can't comment then anymore on that. But what I do know is that at this point, the concern that we have is that that group of people, and we know very well, I know completely how hard this has been for them and continues to be. But I also know that they are in a very risky position in terms of the condition of their own health and the steps that they need to take to protect themselves. What we will do, as I said, is we are working now with the advice that will come to me as the Health Secretary from the Chief Medical Officer's Advisory Group, from our Chief Nursing Officer, from National Clinical Director, about the level of risk that that group continues to face and the impact on that level of risk of any easing of the current restrictions that they are under. I want to be able to agree to some easing, but I absolutely have to make sure that our advice to that group of people, hard though it might be to hear and even harder to put into practice for them, is absolutely focused on keeping them as safe as we can. So we will, in the coming period, reach a view as to whether or not we can ease any element of their current restrictions in any respect. We will communicate that very clearly with everyone in that group, setting out what we believe to be the risks that they continue to face, the advice that we give them to stay safe, why we have reached the view that we have reached, and what advice we're also giving to those who are supporting them, who are in contact with them to give them support as a shielding group. And we will take our time to get that right, notwithstanding the fact that I know that they are very keen to know what, if anything, can my life change, even in a small way, to make it easier than it has been over the last period of weeks. So we will do that. We have not forgotten that group. First Minister made that clear when she published our route map and last week when restrictions were eased for the majority of people in the country. We have not forgotten that group, but you really do matter a lot to us, and we need to get this right for you.